my name is Kim Griffiths. I'm a student physical therapist assistant at Jeff State, and today I will be talking to you about pneumothorax. Pneumothorax is when air leaks from the lungs or through the chest wall into the pleural cavity, causing the lung to collapse. Some signs and symptoms of pneumothorax would be sudden chest pain, shortness of breath, rapid painful breathing, increased heart rate, coughing, and fatigue. I'm getting ahead of myself. Some diagnostics for pneumothorax would consist of a chest x-ray, a CT scan in cases where you need to detect a small collapsed area in the lung. A doctor may also run an arterial blood test, which would measure oxygen and carbon dioxide levels in the blood, as well as using a pulse oximeter to measure the blood oxygen levels. Treatment and medication for pneumothorax would consist of maybe a conservative approach where just waiting to see if the body reabsorbs the oxygen itself with careful observation by a doctor. You also have the option to remove the air from the pleural cavity using a syringe and a needle, or inserting a chest tube between the ribs to suction the air from the pleural cavity. Another treatment option would be pleurodesis, and pleurodesis is the creation of fibrous adhesions between the layers of the pleura of the lungs. And what this does is it essentially scars the area so that air can no longer fill that space and prevent the lung from collapsing again. And pleurodesis can be done chemically or mechanically. Chemically, they just insert a specific medication, such as doxycycline was an example. Prognosis for this, for pneumothorax, there's no long-term complications after a successful treatment, but up to 50% of patients who suffer from pneumothorax will most likely have a reoccurring episode. And physical therapy for pneumothorax would consist proper body positioning just to make breathing easier, and also teaching that patient some breathing exercises. You could also teach them how to expand their thoracic cavity to help improve ventilation, as well as proper positioning and coughing techniques that could help with sputum drainage or eliminating the sputum from the body by coughing it out. And that is all for my presentation on pneumothorax. I hope y'all enjoyed it.